hypoxia. Anyone still remember the name of it? It can be two names. It's dysfunction of oxygen utilization, so we call it histogenous hypoxia, something wrong with the tissue or cells themselves. So it's a histological problem. Histogenous hypoxia refers to the tissue cells cannot make use of the oxygen supplied to them already. The reasons are, number one, tissue poisoning. We call it histotoxic hypoxia. And the examples are the chemical substance that can lead to toxic hypoxia. And vitamin insufficiency, vitamin B1, B2, PP can lead to histogenous hypoxia. And the third reason, which is it's the last but not the least, mitochondrial damage. We know mitochondria are playing essential role in internal respiration. When it is damaged by radiation, bacteria, uremia, which cause the dysfunction of mitochondria, then the utilization of oxygen in the tissue end will be damaged or influenced. The characteristic of blood oxygen is similar to the previous one, circular hypoxia, except the last one. The last parameter of circulatory hypoxia is increased, but in histogenous hypoxia is decreased because the ability of the tissue to utilize oxygen has dropped. And the color of skin is deceptive, healthy pink to red skin color. So deceptive means you can be cheated or conned by the rosy color of the patient while he is not healthy. Here we go. Let's have a look at the functional and metabolic changes of hypoxia. In hypoxia, the respiratory system responds with compensation first. So do the other systems. The low partial pressure of oxygen in artery stimulates the chemoreceptor in carotid and aortic body, which reflexively causes ventilation to increase. So our respiratory activity is more active than normal. In other words, the frequency of your breath and the depth of it can be both increased. So the ventilation gets to increase. After trying the best of our body system to do the compensation, it may fail. That's decompensatory effects. It's a high altitude pulmonary edema, which people suffer in the Tibet Plateau when you get there without proper medical checkup and physical preparation. The central respiratory failure is respiratory inhibition, irregular respiratory rhythm and frequency, hypoventilation, for example, periodic breathing, chain stop respiration, bios breathing, and I'm showing some curves of this typical unhealthy or typical methods of breathing in patients who are in danger. after doing the pulmonary edema experiment and hypoxia experiment on rabbits, you should still remember the breathing curve before you had done anything wrong to the rabbit. It's regular curve with appropriate height of all the waves, but pay attention to what you can see on the screen. They are not regular as you had observed during experiment. And how circulatory system respond? The compensatory response are increased CO, which is cardio output instead of carbon monoxide. Yes, very good. I know some of you are following me to think, to compare in order to remember. The cardiac output can increase because the cardiac contractility, heart rate, and venous return all increase. So we get outcome of cardiac output increase. The other aspect is redistribution of blood flow to important organs. Redistribution. What are important organs? Heart, lung, brain, right? And the most important one are our heart and brain. Heart is a pump to keep our circulation system working. And brain is the headquarters of all functions of our system. The alpha adrenal receptor react to lead to vasoconstriction, and local metabolites can cause vasodilation.